Good afternoon. My name is Shelby and I am here to propose a provision to the current nursing curriculum and the education standards that will provide current nursing students an education to implement end-of-life care. The revision of the curriculum standards will build a well-rounded skill set that is needed to provide nursing care in the moments of end-of-life. End-of-life is a crucial aspect of nursing, and a course needs to be specific to providing end-of-life care to formulate a particular skill set and basic knowledge to provide nurses with the confidence to implement the care in an articulate fashion at end of life. The current nursing programs already have professors qualified to do the job, and the personnel can acquire the proper certification and needs to teach the course. The incorporation of end-of-life care into the nursing curriculum is essential for the futures of nurses, especially with the growing rate of geriatrics patients and patients above the age of 65. The need for nursing education to have a focused curriculum on end-of-life creates the expansion of a skill set provided to provide the highest quality of patient-centered care, and in doing so will properly educate all the nurses on the sensitivities and delicate natures surrounding this complex area of care. An increase of the aging population will eventually proceed to increase the need of end-of-life care, which I had stated before. A brief summary of the ramifications and dilemmas that potentially arise from not having proper education I will present as follows. Nursing in all settings encounter ethical dilemmas surrounding advanced directives. And advanced directives are a big part of nursing care because it provides a foundation in which the patient wishes to have their care in end-of-life moments. A serious ethical dilemma can arise when a patient is without advanced directives or healthcare proxy and the nurse has to initiate end-of-life care or emergency care. The families in these situations tend to put more responsibility on nurses than needed, and without these advanced directives or knowledge of these advanced directives, they no longer can provide care according to the patient's wishes. According to the AANC, there are barriers to advanced directives. They state that there are lack of basic knowledge about these documents and little training. Nurses can't incorporate this type of care. And this is extremely valuable when providing end-of-life care. Death with dignity is another ramification that provide an ethical dilemma that will arise with the growing geriatric population and being in nursing homes. The Death with Dignity Act is a new law that gives patients who are terminally ill or have a terminal diagnosis to end their life. Nurses are going to have to be able to provide sensitive and delicate care to these patients. A nurse in 1997 actually had a moral and ethical dilemma arise when providing a patient care. As nurses, we know that morphine can hasten death or cause an increase in signs and symptoms that can potentially alleviate suffering with death, but this nurse provided the medication to the patient, and the patient died shortly thereafter, and the nurse actually felt at fault for the patient's death. And she went to her supervisor, and her supervisor actually initiated a court case against her because she did not feel the nurse had any type of authority to provide this type of care to the patient, but the nurse was just providing the medications that the doctor had written for this particular patient for the family's wishes. The case was eventually dropped, but without enough knowledge on proper implementation of end-of-life care, this is a serious problem that will arise in regards to end-of-life care and lack of end-of-life education. There is also a lot of false ideas and negative stigmas attached to end-of-life care and the type of end-of-life care. Society has developed preconceived notions and misunderstandings of the administration of controlled substances at the time of death. Conflicts of care may arise when the family and healthcare system try to control pain at the end of life, and the nurses do not have the needed knowledge and educate the patients and family, and it directly negatively affects the way that the patient's pain is managed at the time of death or time preceding death. This ethical controversy also raises questions about the administration of these narcotics, such as morphine, to patients that are actively dying, because it can cause false ideations of the potential that they do cause the actual patient's death. Patients at the end of life are presented with dynamic challenges, and diverse difficulties arise when the emotional and physical ability to cope is compromised and can be overwhelmed by a terminal diagnosis. Nurses cannot properly ease the worries and the concerns of death without the education to build a foundation for appropriate and adequate end-of-life care. The first step to implement the best care to these vulnerable patients is to accept the inevitable death and overcome the negative stigmas that are associated with palliative care and/or end-of-life care. In 2013, prospective studies were conducted surrounding the ideas and perceptions of end-of-life medications by doctors, nurses, patients, and their families in regards to the medications and medicating at end of life. The patients and the summary at cancer.gov stated the use of palliative sedation for refractory, existential, or physiological symptom is highly controversial and experiences more than 1,000 U.S. physicians toward the intentional sedation to conscious until for the patient to be unconscious until death. And actually, not very many. What the study showed was a lot of physicians don't actually prescribe all of the means. Roughly about 10% prescribe palliative sedation or palliative pain measurements preceding 12 months of death. The survey conducted the same research proved that only 18% objected of it to the unconsciousness or sedating of patients that are actively dying. So in summary, only 10% of physicians actually prescribe and only 18% oppose, which isn't very much given that education and knowledge that these physicians have surrounding end of life. So this project for facilitating a focus course on end-of-life education for nurses would include proper reading material on providing meaning and pain relief and all the different emotional, physical, and medical aspects, along with the scientific, that accompany end-of-life care. Project time and effort on the project would cost a total, including training for staff that already are there, would cost a total of $15,000. So in conclusion, end-of-life care must be approached with sensitivity and consideration, with a very delicate and educated, knowledgeable background. Educating nurses appropriately about end-of-life care ensures the highest quality of care in the healthcare setting, especially with this vital aspect to nursing. This is a very important and vital part to nursing, regardless of whether or not it has a very sad or emotional tie to it. So, in conclusion, the incorporation of a focused end-of-life course on end-of-life education is crucial to the future for nurses. Thank you very much for your time. Take care.